As the local flu outbreak continues to grow, some parents are finding it difficult to find the vaccine for their youngsters at the doctor's office. WHAS 11's Adam Walser joins us now live from Corsair Children's Hospital, and he's been talking to the doctors and the parents. Adam?
That's right, Melissa. Corsair Children's Hospital here has seen a dramatic increase in the number of admission of patients who are suffering from flu-like illness. And in fact, several other hospitals are as well. In fact, Baptist East and St. Mary's and Elizabeth hospitals both had to divert some of the patients who were coming into their emergency room because of the large number of illnesses at those two hospitals. In addition to that, there has been a shortage in some of the vaccine meant to protect some of the most vulnerable members of the population. At this indoor playground, it may seem like another carefree day of fun for the kids on hand. But if you look closely, you'll see a whole lot of cleaning going on. One of the reasons? An early flu outbreak that sent thousands nationwide to the emergency room. Belinda Herzig's husband was one of those victims.
That in 20 years, I've never seen him so sick. So we decided our 9-year-old should have the flu shot.
But getting a flu shot this late in the game can be tricky for some.
Oh, it's been tripled at least.
Dr. Catherine Abbott says the volume of sick patients pouring into her pediatric office is astounding. Yet she's not able to get flu vaccines for children 3 to 5 years old.
For us being smaller, it's much harder. We don't order in bulk. But also the two manufacturers actually ran out this year.
The little clinic at the Hubbard's Lane Kroger has been filled with plenty of patients who can't get the flu vaccine from their family doctor.
So if we've been low on it, we've been reordering supplies, so we're still able to give it. And we're probably one of the few places that still has supplies. We've had a lot of people call just trying to find it.
Betty Seifert got a call out of the blue warning her to get vaccinated.
When they called yesterday, I knew I had to get over here.
Your insurance company actually called you?
Yes.
Have they ever done that before?
No.
As the flu reaches near epidemic proportions in other states and the number of cases continue to grow in Kentucky, healthcare workers say the most important thing people can do is get the vaccine. Supplies are available at the health department, pharmacies, and most urgent care centers in the area. How would you equate what you're seeing this year to what you see most years?
It's probably the worst, at least in the last 10 years, maybe even a little bit more.
You even got the flu.
I even got it, even though I had a flu shot.
Now, Dr. Abbott believes that she got the flu because she was exposed to a mutated form of the influenza germ. She says she's exposed to so many germs that that's not really a risk to most of the population, but she says that it's the best way to protect yourself, and she urges anyone who's not gotten the vaccine to do so as soon as possible because it takes about 2 weeks to become fully activated. Reporting live from Corsair Children's Hospital, Adam Walser, WHAS 11 News.
Good evening, everyone, and thanks for joining us. I'm Melissa Swan.
And I'm Doug Proffitt. First here tonight at 6 o'clock, 18 children have died nationwide, and thousands of children have been hospitalized because of the flu, including here in Kentuckiana.
And as that outbreak continues to grow, some parents are having a hard time finding the vaccine for their kids. WHAS 11's Adam Walser joins us live from Corsair Children's Hospital with the latest on the flu. Adam?
Well, Melissa, Corsair's Children's Hospital and several other healthcare facilities in the area are being swamped with new patients coming in exhibiting flu-like symptoms. One of the problems is that area pediatricians can't get the very vaccine that would keep some of those kids healthy.
Oh, it's been tripled at least.
Louisville pediatrician Dr. Catherine Abbott says she's seeing plenty of sick young patients these days. How would you equate what you're seeing this year to what you see most years?
It's probably the worst, at least in the last 10 years, maybe even a little bit more.
Yet Dr. Abbott can't get flu vaccine for 3 to 5-year-olds. Two manufacturers already ran out of supplies due in large part to a vicious early flu season this year. While some small practices can't get flu vaccine, health departments, national pharmacy chains, and urgent care centers do still have adequate supplies locally.
Probably one of the few places that still has supplies. We've had a lot of people call just trying to find it.
The Kroger Little Clinic has been giving lots of flu shots and treating plenty of sick patients in recent weeks. What do you do to keep from getting exposure to all these?
Use alcohol gel, I think, 1,000,000 times a day.
In addition to getting flu shots, medical workers urge folks to try to limit exposure to germs any way they can. especially when they are in places where they come into close contact with others. At this Chick-fil-A here in St. Matthews, they not only spray down all this equipment and wipe it several times a day, they also provide hand sanitizer so the children clean up as soon as they leave the play area. Wendy Burhan is a nurse whose husband is a pediatrician. She says he is now more careful around his children.
He goes straight upstairs to the shower, changes his clothes, takes a shower before he comes down and lets the kids touch him.
She says the most important thing is to vaccinate children and then do whatever is possible to keep them healthy.
A vaccination is not 100% foolproof, but you can't keep your child in a bubble. Just practice good hand hygiene.
Now, healthcare professionals remind us that the two most vulnerable populations are the very young and the elderly. Both could have compromised immune systems, and it is important to get those flu shots just as soon as possible because they take up to 2 weeks to be fully effective. Reporting live from Corsair Children's Hospital, Adam Walser, WHAS 11 News.